Hey Spencer, you're very welcome. Thank you for the follow-up questions as well. So you mentioned about going to see the doctor, and the doctor has told you that there's muscular issues, which is pulling the atlas out of alignment. To be very honest, I don't usually agree unless someone is extremely physically active or unless someone is some sort of athlete. So, someone is doing a lot of headstands, or maybe they're doing boxing or they're exercising, hours and hours per day, then absolutely it can be a muscular issue. Usually it's more the other way around, where the atlas is out of alignment, whether it's due to postures, habits, sleep positions, traumas, accidents, injuries, maybe even builds up gradually in the background, things like stress and fatigue. And then when that's out of place, that will then lead to the tension in the muscles, particularly if the muscles are tense on one side rather than on both sides. If you have tension more on one side rather than both sides, so what we call unilateral rather than bilateral, that's usually where the body is spasming to try and protect something. As an example, say we have these joints here and say, so say things are more out of place in this direction, what will happen is the muscle that's on this side, because there's lots of muscles attaching to here, will start to try to pull it back. And most of the time it will. Most of the time these muscles will pull things back into alignment without us having to do anything or even realizing it. However, it's when it keeps happening chronically, that's where something may be chronically stuck. So usually it's more the muscles are pulling in that area. And especially the way you describe it, yeah, I agree. It does make sense. It could be the atlas because it is going down to your shoulder, your upper traps, which does have an attachment point on to the atlas, the C1. But usually, again, unless you're someone who's very, very, very active or you have a specific muscular issue, it usually is going to be at the joint, and the muscle is a reaction to that rather than the other way around. As for the MRIs you mentioned for the IIH, you said they came back clear, and you said whether it can be trusted. To be honest, I would trust them. Usually it's going to be the best way to detect them. Looking for IIH or expecting it to be there, it's a rarer condition. It's not that common. It's only going to be, I think, 1 or 2 people per 100,000 people who have this. So if we have lots of other things which are much more likely, it's better to try and expect them. There's a famous saying, when you hear hooves, think horses, not zebras. And the same thing for this. Even though there's all these different symptoms that may correspond with something like IIH, it's also more common that there may be something more happening in the neck. It may be something happening in the nervous system, other neurological issues, which are much more common and much more likely to happen than IIH. And especially, again, if it's been ruled out by MRI, which for this I believe is the gold standard, then I would trust the results that you have. If you have any more questions, you can drop them down in the comments or follow for more information like this.